Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. How long is the COVID-19 infectious period? With COVID-19, you can expect to be contagious for about 1 to 2 days before symptoms appear, and stay contagious for up to 8 to 10 days after symptoms start. The contagious period might be shorter if you are asymptomatic or vaccinated, and longer if you have severe symptoms or a weakened immune system. /r/n/r/n If you test positive for COVID-19, isolate until you've been fever-free for 24 hours without medication, as per CDC guidelines. You should also take extra precautions, like masking and physical distancing, for 5 days afterward to avoid spreading the virus. Follow your healthcare provider's advice during recovery for tailored guidance based on your health status and situation. /r/n/r/nLazy_bear, Getty Imagesrnrn Most people with COVID-19 are no longer contagious 10 days after symptoms start or after a positive test. This timeline generally holds, though transmission risk can vary. /r/n/r/n Once exposed to COVID-19, it takes 2 to 3 days to show symptoms. This period is called the incubation period. Even before symptoms start, you can spread the virus through breathing and talking. You're most contagious when symptoms start and the virus level, viral load, in your body is highest. /r/n/r/n Not everyone with COVID-19 peaks at the same time, and a lower viral load doesn't always mean less virus is being spread. A 2023 study found that people can exhale up to 800 copies of the virus per minute in the first 8 days after symptoms start. Therefore, continuing to wear masks and following other precautions is important even after isolation ends. /r/n/r/n COVID-19 can be contagious for more than 10 days, especially in severe cases or for those who are immunocompromised. The CDC notes that people with severe illness, such as when pneumonia or severe respiratory distress is involved, or compromised immune systems may shed the virus for longer. /r/n/r/n Studies show that severe infections can result in high viral loads, extending contagiousness to over a month in rare cases. Immunocompromised individuals, such as those on chemotherapy or with advanced HIV, may shed the virus for a median of 4 weeks, according to a 2023 study in the journal Pathophysiology. /r/n/r/n After testing positive for COVID-19, you might continue to test positive for up to 90 days, especially with NAAT tests. Reinfections can happen within this period, making it difficult to determine if a positive test is from a new infection. /r/n/r/n If 10 days pass and you are still testing positive for COVID, you should still consider yourself contagious. It's best to continue isolating until you have been fever-free for at least 24 hours. /r/n/r/n Immunity duration varies by age, health, and vaccination status. Studies show that vaccines are most effective during the first 3 months after vaccination. Natural immunity to the virus also weakens over time, but does so faster than the protection provided by vaccines. /r/n/r/n The first sign of a COVID infection is often a low-grade fever, defined as a body temperature between 100.4 F and 101.5 F. Not everyone infected with COVID will have a fever, though. /r/n/r/n The first signs of COVID could also include /r/n/r/n About 44% of COVID-19 infections in the US are asymptomatic. This is a major public health challenge since the virus can still spread without symptoms. /r/n/r/n Asymptomatic cases are generally less severe and have a lower viral load. Typically, asymptomatic individuals shed the virus for about 6 days, while symptomatic individuals shed it for an average of 9 days. /r/n/r/n Most otherwise healthy people are no longer contagious 10 days after their symptoms begin. People with a weakened immune system or severe illness may remain contagious for 4 weeks or more. r/n/r/n compared to previous strains, newer COVID variants spread more easily and can make people sicker because they can dodge immune system detection. /r/n/r/n As the virus mutates, the mutations that survive best are the ones that escape immune detection, making it harder for our bodies to fight off the virus. /r/n/r/n As of May 2024, the most dominant variants were a group of variants called FLiRT, which include the Omicron subvariants KP.2 and JN.1. /r/n/r/n FLiRT variants are considered more contagious than previous ones. They have an increased ability to infect cells and evade the immune system. This is true even for people who have been previously infected or vaccinated. /r/n/r/n According to a study in the Journal of Allergy and Clinical Immunology, which monitored 1,394 families from 2020 to 2021, children were actually more likely to transmit COVID-19 than other members of their households. /r/n/r/n This was explained by the fact that 75% of the children were asymptomatic for COVID-19 and may have unknowingly spread the virus through nasal secretions and hand-to-nose behaviors. /r/n/r/n People who have received an updated vaccine have a reduced risk of infecting someone else with COVID-19. However, your contagiousness likely depends on a few factors, including how recently you got a booster, and whether you are immunocompromised. /r/n/r/n A 2022 study published in JAMA Network Open was one of several that showed that fully vaccinated people have a shorter duration of infectious viral shedding as well as a lower risk of transmitting it to others than either partially vaccinated or unvaccinated people. /r/n/r/n The study, which involved high-risk healthcare workers, hospital patients, and caregivers, found that the duration of contagiousness was roughly 10 days for unvaccinated people and 8 days for partially vaccinated people but only 4 days for fully vaccinated people. /r/n/r/n Health experts generally agree that COVID-19 is here to stay and that continued vigilance is needed as new variants and outbreaks emerge. /r/n/r/n To protect yourself and others from this highly contagious virus, the CDC recommends the following preventive measures. /r/n/r/n The contagiousness of COVID-19 can vary. Generally, contagiousness starts 1 to 2 days before symptoms begin, and lasts for 8 to 10 days after symptom onset. People with mild or asymptomatic illness are usually no longer contagious after 10 days. People with moderate to severe illness or who are moderately to severely immunocompromised may remain contagious for 4 weeks or more after symptoms begin. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.